Welcome to The Creative Influencer, where we discuss all things creative with an emphasis on influencers. The Creative Influencer is hosted by John Pfeiffer. John is an entertainment attorney in Santa Monica, California, who represents influencers and other creatives.
This is episode 3 of the second season of the Creative Influencer podcast. Today we interview Dr. Jennifer Berman. Dr. Berman is a New York Times best-selling author, a practicing urologist, a pioneer and leading authority in the field of female sexual health, a former host of the award-winning CBS talk show The Doctors, and a longtime advocate for women's wellness issues. Dr. Berman is uniquely qualified to discuss how social media is shaping both women's self-image and the sexual norms of future generations. Stay tuned for a fascinating conversation. I am joined today by Dr. Jennifer Berman. Welcome to the podcast.
Thank you.
You are a urologist and sexual health expert.
Yes.
And you are a celebrity in your own right.
Okay.
Am
I all right?
You have that coveted
According
blue.
to me.
Yes, indeed. You have that coveted blue check on Instagram.
Thank you.
And you have been on many TV appearances, and we'll circle back around on those, but including the Oprah Show and Conan O'Brien.
Yep.
Okay, so because I've done a deep dive into your background in the sense of your professional background, and I also noticed that you come from an accomplished family, which we'll get to in the future. But where are you from originally?
Originally, I was born in New York, in Manhattan, and we lived in New York until I was about 15, and then my parents moved to rural southeast Georgia from New York, and so that kind of was a defining moment, I think, just in the trajectory of my life, and it was really a lot culture shock.
I can't imagine.
To put it mildly, and verging on traumatic, but it is, I really enjoy it now. It's a place that I go back to with my kids, and I appreciate it. But it was very different. The Bible Belt, we were Jewish. There were very few Jewish families down there. We got the whole anti-Semitism talk from it was like an out-of-body experience.
Right. And then, did you stay there through high school?
I was there through high school. My sister's 4 years younger than me, so she was there longer. So she was there for all of high school. So I was only there, 10th, 11th, and 12th grade. But I think it kind of shaped, my path, because I went to college in the South, and I was very, so I sort of like acclimatized to a southern kind of way of thinking, and and so that shaped me in different ways too. And, but then I went to college in South, and then I ended up deciding after I graduated from college that I wanted to go to medical school.
Well, that's what I was going to ask. What led you to medicine?
So my father, was a colorectal surgeon, and, so it was sort of something that I knew and was exposed to throughout, my childhood. And I would spend time with him in the operating room. Back in those days, I could go make rounds. I could go in the operating room. I was like putting sutures,
So it was the family business.
It was sort of like, and not only the hospitals, it was very, embracing and just sort of a way of life, but not something that I wanted to pursue as a career until after I graduated from college. And I chose my college at that time because I loved horses, and I brought my horse. I was very,
So you brought your horse to college with you?
Horse Josephine came to college with me.
I got to digress a second, because I saw you participated in horse jumping competitions.
I still do.
Well, I mean, yes. I didn't mean past tense. When did you start doing that?
So that was in New York when we lived in Manhattan, but we had a home up in Cold Spring, New York. So on the weekends, I would ride horses in the pony club there. And then I got sent away to summer camp, as they do back east. They don't really do that here in California. But back east, everybody went to summer camp, and I was sent to horseback riding camps and just, fell in love with horses. And it's a big part of my life. And so the horse came to college, and then I graduated college, and then that's when I went to medical school and didn't have horses. But as soon as I was in my residency in Baltimore, I ended up going to Baltimore for my residency, and I sold a car and got a horse, and I've had them, not such great horses, a little bit of crazy horses. And over time, I've been able to get better ones.
Now, did you always do horse jumping, or was it other competitions?
Well, jumping competitions always, yeah.
How did you start that?
The pony club, they teach you just work your way up from like grooming and picking hooves and the pony clubs, they have you doing crazy things like vaulting and, like fearless cross country, they totally acclimate you to horse life. And some people, enjoy it and it's a passing. Some people, latch onto it and make careers out of it. Others, it's because, I'm not gifted. I don't have the raw talent to become a professional rider, or I may have, because I certainly love it that much. But it's definitely an addiction, so to speak. Those that when you have that bug, like to the degree that I have it, and my daughter does too, it's it's in your blood. It's in your blood. You can't not have horses. It's it's your peace of mind. I go out there and for my sanity and. Yeah.
Because I grew up on a farm in Nebraska, and my dad would not let us get a horse. Because he
Really?
said you had to feed it all the time. Instead, he got a 4-wheel drive pickup because you don't have to feed pickups. Which there's logic to it from a utilitarian perspective. But at any rate. So back on track on your medical, you picked urology.
Yeah.
How did you pick that subset of medicine?
So I knew that I wanted to do a surgical subspecialty. And again, I had been exposed to it when I was, from my father. And so I went into medical school thinking that I wanted to do general surgery, something surgical. And on our third year rotations, they assign you electives. And you could choose, but I didn't get any of the ones that I chose, like plastic surgery or ENT, whatever the good ones were that I thought I didn't get.
Quote, good ones. Yeah.
And I got a urology, and I said, oh God, what is this? And I did the elective, and it just happened that there was one of the attendings was, who ended up being one of my mentors, just happened to be super passionate about, for one, urology, but also teaching and medical students and embracing them and giving them projects and he was very, not the other rotations would sort of tolerate you and, okay, these ones are here now. So, they kind of shuffle you around and nod and, but not really go out of their way you were more of a responsibility than something that they were enjoying. So it was just a fluke that he happened to be there and he was like that. And so there were projects that I started that I continued through the course of the year that kept me coming back there. And then it became, something that I enjoyed and that I appreciated. It is a surgical subspecialty. At that time, there were very few women in it. So I saw.
What percent are there of women versus men?
Well, now it's pretty much equal, but then there was not. It was predominantly men, very few women that were board certified or that were wanting to go into it. Now they need women. For female urology is a whole field, and it's they want women, but then there were few, and I felt that that there was a need, and that it is a surgical subspecialty, and people are generally healthy. It's not life or death. I had just come off of general surgery, which was exciting, but extremely grueling, depressing, and, require the higher you ascended in rank in terms of being, seniority in the hospital, the worse life got.
The worst cases. Yeah.
But in urology, the higher seniority you got, the better. Those guys were out playing golf and, they had people in the hospital taking golf. So it was a different, it's not, the cowboy shock trauma kind of, fraternal thing, although it is, there's a lot of kidney trauma and bladder trauma and cancer and, congenital abnormalities of the genital urinary tract. There's a lot of complicated and serious surgery, but predominantly the patients are healthy. They have an acute problem that needs to be corrected. You fix it, they get better. And, I like that.
And then you also have a focus on women's sexual health. Tell me about that journey.
Well, sexual health in general, when I was rotating in urology as a third-year medical student, that mentor happened to be Irwin Goldstein, whose whole practice was devoted to male sexual health, so male ED. And he was a pioneer in that area in terms of the pharmacological therapy, in terms of the surgical therapy, the implants they were doing back then. And he was doing penile revascularization procedures for young men that had injuries and whatnot. So it was a real, in a pioneering moment for sexual health. And when I got interested in that. And then when I was doing my residency is when Viagra got approved right then at 1998. Viagra was getting approved for men. And it was the first, and that was like groundbreaking. And there was a lot of interest and a lot of media attention surrounding that. And I did my residency at University of Maryland, and we were one of the primary centers doing those clinical studies. So there was a lot of interest, a lot of media, a lot of focus, asking questions about,
what is this?
Yeah. And so as awareness increased about Viagra, then there were women started pouring into the clinic asking, well, what about me? Or what about this? Or my husband wants to have it. And all of this like plethora of women, inundating the urology. And they were like, well, what do we do with these women? We're men. And, Jennifer, deal with them. And there was really, and I recognized at that point that there was a disparity from how we address male and female sexual issues, that there wasn't really a medical focus, even from the gynecological side. And so that's how I kind of went about, trying to pioneer that area as a urologist. And I took a very male-oriented approach at first because that's all I knew. I did this here, now I'll do it over here. We've got blood vessels, we got nerves, and I tried, to the best of I could, from a physiologic standpoint. And then from there, we had to add hormones. And from there, we added the brain. And from there, we added the relationships and all these other things that are now, sort of custom in practice.
Now, you are one of the leaders in the field in the sense of one of the early ones to start in it.
Mm-hmm.
Do you have competition now? I mean, are there others in the field?
There's so many now. Like back then, there were very few that were doing this kind of work, and certainly not in a medical setting, much less an academic setting. And now there's many people, like even just routine gynecology. Like this was the goal, that primary care doctors, therapists, gynecologists are all kind of incorporating aspects of this into their practice. So there are a lot of people that are not necessarily specializing in it, but that are addressing the issues, that have awareness and that have the ability to treat, for the most part. The problem is for women, there's not many FDA approved treatments. It's kind of a complicated, subjective, issue that isn't easily addressed with a medication. So that's the challenge.
I want to transition. I'll come back to this, but I want to transition to your TV appearances.
Mm-hmm.
Okay, you've just the list that I've compiled. You've appeared on the Oprah Winfrey Show, Dr. Phil, the Today Show, Good Morning America, CNN, and Conan O'Brien.
And many more, because back then, like I said, when Viagra was becoming approved, I was working with my sister, who's a therapist, we were the only ones doing this. So there probably isn't a show other than Ellen. I've never done Ellen, but she has some issues about sex. Like nobody talks really about it on her. That's the one that we have never done. And I don't, other late nights, I don't think I've done Jimmy Kimmel or Fallon or the late night shows, but every daytime talk show and we've done, and then some. And then, and that's based on, one thing led to another thing, and kind of.
Do you have an agent that books this, or is it just referral that the producers have seen you?
Those were all self-referred. And I have an agent and a manager, but the agents I'm not an actress, so they're not like booking auditions and things for that. Right. So these things, and publicists, when I've written some books and we've had publicists associated with that, and then they would book things, but I never really had to go out and proactively, seek these opportunities. I get asked a lot by doctors, because, how do you do that? I want to get into media. How do you do it? And it just happened. I didn't try. If I had to try to tell somebody what to do now, you need to have a publicist. It's not an agent, because like a PR person that has a pitch, and you have to have, you have to look a certain way and have some sort of, gimmick, edge,
some hook,
idea, issue that's, compelling. And that fits into a timetable of what they're doing. And then also connections, knowing somebody who knows the producer of this. And then cross your fingers and hope it goes well.
Now, do you have a pre-appearance ritual that you go through?
No. And I am a professional guest. Like, I can do that with my eyes closed and, and just go with it, whatever. When I have to, and I've had to because my sister and I had a show called Berman and Berman, and we were hosts of that. And then on The Doctors, I was a co-host, so I didn't really have to carry it. I could just do my thing. So when I can just do my little thing it's very easy for me. If I have to carry it and do it this is the next stage of my career, is the expectation that I'm going to have my own show, which is, I'm mixed feelings about, because, that's a whole nother level of responsibility, of, headspace, preparation, and also ability, like even just learning how to read the teleprompter without, you have to
without looking like you're reading.
Yeah, looking like reading. I had to learn how to do that. And so on The Doctors, we would do different, pickups, intros in and intros out, or integrations about products that have to read something. And, that was a skill set that you have to learn. So, so the ritual would be, preparing when there is preparing to read the information and content and have mastery of the information. If there's a script, read it, try and get it. Oftentimes they don't want to tell you what the questions are before, but for The Doctors, I knew what the script was, and knowing the information, having some semblance of
where
awareness,
it was going,
what you're going to say. And then the biggest challenge is if it's live. So live, the 3D. If it's taped, it doesn't matter. You can make mistakes. You can stutter. They'll cut it. They'll edit it. If it's live, then it's like a whole nother.
Did I tell you this is live?
Maybe,
No,
but it's
it's
radio,
not.
so there's no camera to it. But the live thing, like with Good Morning America and those shows, or even Conan, is live to tape. So it's a live audio. You're not really allowed to mess up in that either, even though it's not live. It kind of is live. So, it's a higher level of,
I know this is going to be like asking you which is your favorite child,
mm-hmm.
but which was your most fun show?
I think the Conan ones were probably the most fun, for sure, and out of my comfort zone, and interesting. And then also having a live audience, and there were a lot of men, and it was male oriented, and then there were celebrities on there, so that was probably the most fun. Oprah was back then, but that's going back in time, that was like a big deal. It still is. And that was amazing too. I wouldn't say it was fun. And Good Morning America ended up being fun, because I would do those a lot, but it wasn't in the beginning. I would have panic attacks, literally, like palpitations, the blood running out of my lips. And I do those with my sister, and she'd see me like starting to sweat and melt, and then she would start, and then within like a minute and a half, I could come in. But the first minute is like dying.
For the listeners, there are many of the Conan appearances are on YouTube,
mm-hmm.
and I would highly recommend them, because you taught Conan to do male Kegel exercises.
We taught him how to do male Kegel exercises. We taught him where the G-spot is. We taught him about a lot of things.
You taught him about the jade egg.
The jade egg for improving pelvic floor. We taught him about Foria, which is a cannabis product to enhance sexual pleasure in women. And
did you come up with the concepts, or was it the producer? Are you talking to the Conan producers?
I talked a lot to the producers, and they want to know like what content they would learn things on their own and ask me, or that I would say things to them, and then we kind of there's a predetermined
discussion.
Yeah.
And then you stimulated. My favorite is you stimulated him with the womanizer.
Yeah. Then he learned about the womanizer, which is not really a vibrator, but an erotic toy for women. And we use that on him.
Which show, intuitively I think I know, but which show has had the most impact on your career?
I guess those shows are most like recognized and people see. I think the biggest one on my career would probably be co-hosting The Doctors, because that became a platform for brands. Then there would be large brands that wanted to align with me based on that platform, as seen on The Doctors or whatever else. And so that there would be, with Kimberly Clark, with Poison Depends, and a large Johnson & Johnson, large Cram Ocean Spray. So that platform led to larger brand spokesperson advocacy opportunities, if we're talking about career.
How long were you on The Doctors?
For like 4 seasons. I've always been on sort of as a intermittent expert, but like as a recurring every week having to go in there about 4 years. And I think it's still going. It's not, the ratings aren't so great. I think they're kind of like.
I believe it is still going, because I Googled it last night.
You did. And I think Dr. Phil's kind of like, funding it along, but it definitely is, that was a really good learning experience for me about, just being an on-air host and navigating all, and being able to co-host, because I'm used to just talking. Like when somebody asks a question, I answer it, and there's nobody else talking. But now a question's and then there's 3 other people talking, and you have to learn how to
manipulate that. Have you always been comfortable in front of a camera, or has that been a learned thing?
I didn't know that I was comfortable or not comfortable. I just did it. And from the beginning, when I said those studies were going on and the press was showing up at the hospital wanting to speak to the clinicians, and they kind of threw me out there and said, talk to them. And I just went out and talked. And I guess, I looked okay, and I said, and then they were like, oh, she's good. Let's have her come back. And that led to those interviews when I was a resident, not having slept in my scrub. I just went and said, led to, CNN and Charlie Rose and Anderson Cooper and Larry King, like all just, who's this woman talking about sex? And so that it was sort of a novelty. And then with my sister, and we were in Boston at the time. They were like the mini Dr. Ruth and the Viagra twins. There was this novelty of these 2 sisters talking about sex. And, so that was.
And I want to turn to the books with your sister in a second. Do you find that talking to men about sex is difficult for the guy? I mean, you clearly don't have a problem talking, but is it difficult for most men to be comfortable talking about it?
When I was practicing, like as a urologist and a fellow, they a little bit. Much older men and then very young men were kind of like put off a little bit, but otherwise they just, whoever, it was a clinic and you're the doctor, you're wearing a white coat and, whatever. They sort of, this was like University of Maryland, the urology clinic. They wasn't, they were happy to have a doctor. But now I think, if they're uncomfortable, they don't really, let it on that much. I think more in personal relationships, it's probably the misconception that because I specialize in this, that I have some, innate abilities or talents or knowledge beyond, most, which isn't the case. And obviously.
Well, I was going to ask then, in the personal side, is it hard for men as friends to talk about this? Because most guys don't even talk to the other guys about it, but yet alone to talk to a woman about what you do.
They do, for however it plays out, once you sort of open up those doors, I think it just has to do with my level of comfort. There's not, people always ask, are they intimidated by you or whatever, I don't know. I know that, it always comes up, and it's annoying, that feeling of that I have some like hidden abilities or whatever, or that, there's this,
magic bullet somewhere.
Or that I, like in my sexual, what do they call those? Like a surrogate, like I've got all this, these skills and things. But for the most part, I think that, that the men are pretty open about having those discussions, and it's becoming more timely, and there's less of a stigma associated with it. And, yeah.
So you are an author.
Mm-hmm.
You've written at least 2 books that I was able to find. And they're both with your sister. Mm-hmm. The first one was, I don't know, first in time, but the first one I have on my list was New York Times bestseller for women only, A Revolutionary Guide to Reclaiming Your Sex Life. Mm-hmm. How did you come up with the idea?
So that book, For Women Only, A Revolutionary Guide to Overcoming Sexual Dysfunction and Reclaiming Your Sex Life, we got, it was just, I forget, I was at Boston University in the crux of all of these things going on. I had finished my residency and now I was doing research in Boston. That's what happened. And we had an opportunity or a desire to kind of put it all together, everything, the research and everything that we were doing. And my sister had finished her PhD with this woman named Helen Fisher, who was an author who'd written The Anatomy of Love and Mating in Captivity. She was an anthropologist. And so Helen Fisher had a literary agent named Binky Urban, who was like Devil Wears Prada. She was an agent at ICM. She may still be, and she was the literary agent of nonfiction. And because of Helen Fisher, my sister had trained under Helen Fisher, we got to Binky, and Binky saw,
the possibilities for
the possibility, and it became these, we became her little minions, and she went out and she pitched, and we got book offers, big ones. And so then that's how that happened. And then she arranged for, that was with, Simon & Schuster, I think. And then they had a public PR department within that, but Binky got another publicist. They got them to hire another PR firm. What were their names? But those are the ones that got us on Oprah and People Magazine. And that's how it became a bestseller.
We're talking
Hilsinger Mendelssohn. That's who they were. And they, I think her name, was it Lippy Taylor? I don't remember, but whoever the publicist was had the connection at Oprah and just hounded. And once we got in there.
Your sister's name is Laura Berman.
Yes.
She is a relationship therapist. Mm-hmm. How did it happen that both daughters
ended up in this field? That's a good question. So she's a sex therapist, relationship therapist. It's an interesting, I don't know exactly, however, but, with my father being a colorectal surgeon, and there was a lot of open and frank discussion about anatomy and body parts and sexuality. And
I can only imagine Thanksgiving dinner was an interesting conversation.
And my dad was very provocative and, sort of, pushing people's comfort zones and talking about subjects that people didn't want to talk about. That was normal for us. So that probably is how.
What is it? Your second book. Sorry, I forgot. Want to hit that. It's Secrets of the Sexually Satisfied Woman. Mm-hmm. 10 Keys to Unlocking Ultimate Pleasure. And it was based or centered around a National Women's Sexual Satisfaction Survey. Right.
So we had created the survey with RAND, which was the whole fun of that book, was working with RAND and Gallup to create a validated survey, learning how to do that with the phone, do it through the phone and randomizing who the people were. And so that was the process of that book. And that, and so that was identifying the similar characteristics of women who were happy and satisfied. What do they have in common?
What's the top 3?
It remains the top 3 is that they have, happy with your sleep, happy with your overall general self-esteem and happiness with yourself, and happiness and satisfaction with your partner.
Now, having been a published author on 2 successful books, what's your takeaway lessons?
I don't like writing books. I really hate it. I feel like I need to do, there's ideas and I want to get them out. But the process of writing, for anybody who has the idea, I want to write a book, it's agony, for me at least, torture. Because it's, you have to be like sitting for long periods of time and going into, and like big, like looking at a huge mountain and then you're like one step in, and that every day. So you have to, like, it's a unique field for writers, a very solitary, kind of confining, isolated, depressing. Because I'm a big picture person and I want to delegate. I don't want to be the one to write. So we had actually a co-author. She wasn't a blind, what do they call it? A
ghostwriter.
Ghostwriter. Because I wasn't going to hide it. We need her. And her name is Elizabeth B. Miller. And she went on to be the White House correspondent and had a really big career, not because of our book, but she was very talented.
Well, how do you know it wasn't because of your book?
Maybe it was. And so she would, I could dictate to her and she would ask questions and I would just talk. And then she would put it in some sort of context. And then the editor, this is what I realized too, nobody gives them credit. The real writers, the really gifted writers are the editors. Maybe they're not the most creative. I don't know why they're not writing because they're the best. Like she could take whatever, this, and turn it into exactly my voice and exactly the way, and the way that it flows and this and the arc and whatever. And, it was amazing. So, so editors, good editors are like very, very talented.
So even though you don't have any plans to write another, or even though it's painful to write books, do you have any plans to write any?
I don't have any plans, but I will. I have lots of ideas for them, but I really would need a person who can take the ideas, organize them, because I'm a little bit and give birth to them in a way, because I would have to quit everything. It's a full-time job to really do it. And, if you're writing and like there's a woman named Christy Funk, who's a breast surgeon. She's the one that operated on Angelina Jolie. And she has a really busy practice. And she just wrote a new book, like the gold standard for breasts. And it was a huge project for her to undertake. And she has triplets.
Oh, wow.
Yeah, they're like tweens now. It just is, it's a lot.
Would the starting spot to your path to celebrity be Viagra?
I think the starting path to my
it's an odd way to ask that
celebrity
question,
was just chance, being in the right place at the right time, of a change in culture. There was something going on in America at that time, an awareness. And I was, in Baltimore, Maryland, in a little, university setting, and got in front of a camera, not by choice, by default, and then that sort of snowballed. And have
you had help with your brand, or has this been all you?
I have no help with my brand, and I really need help with my brand, even as I get older, because I'm realizing, as social media has expanded, and as there's more and more of these people and these things, and the messaging is getting more diluted, and people are getting confused, and I feel like that I have a platform and years of wisdom and experience that needs to be encapsulated and delivered. And, in terms of not only information, in terms of not only education, but developing of products, books that I don't like writing, but that need to be written, and things like that.
What advice would you have to young doctors who are starting out?
It's very hard. Medicine is, I think this new age of doctors is going to be, because medicine has changed so much, the people going into medicine are going to have to be better in terms of an entrepreneurial spirit. And they're going to be with telemedicine and robotics and technology, the next generation of us are going to be business and tech savvy. They're going to be able to come out of practice, and there are going to be social media and marketing. You can't just finish residency and then put a shingle up anymore, which is what we did. You just were a doctor. You were in the yellow pages. Now, these guys that have been in practice for decades, the real heroes of plastic surgery, are getting taken out by the young guy coming out that has, the bots and the this and the marketing, the Facebook, they're regardless of their experience or their ability. So I think that, the advice is to learn about social media, learn about marketing, because you can't just rely on your medical degree anymore. You have to be able to reach the consumer, and patients are now consumers. They're not just patients. So it's a different business.
You have a large social media following. Do you have a favorite platform?
I don't really, Instagram is easier for me. What I need really, as a doctor myself and all these other doctors, you need a social media person, and you need a search engine optimization website person, and you need a marketing and branding person, and you need a publicist. So now if you need all those things, imagine, so your budget that you need per month to manage all that. So if you need that budget in the 30,000 range to really do it, then how many patients do you have to be seeing? Certainly not managed care. So now you have to be going out. So it's a whole different ball game. And so none of the social media venues really appeal to me, but I do them. I have to do. Instagram is really easy, and I have no idea I just post whatever. I need a social media person to kind of tell me and direct me and do this and do that. But so again, I've been lucky that I can just sort of exist and do that, and I've maintained sort of a status quo. But the next phase of what because now I'm getting old. I'm in my 50s. I'm only going to be able to be in front of the camera for, I'm getting old. My brain, maybe I'll get Alzheimer's. Who knows? So my brain is still good. I'm still physically in shape. And so I have to, I feel like there's a window of time that I should be like, what my pièce de résistance or whatever, that I have to, figure out what that next thing is going to be.
Have you seen in your practice any impact on the impact of social media on women's self-image?
Yeah, totally. Especially about their genitals and this whole the way things look down there and changing the way they look. And 100% social media has impacted not only body image and self-esteem, what's aesthetically pretty or not, but even in their genital area, how things should look and should seem. Is social media has impacted that.
How would a woman decide what they should look like?
Because based on ideals that aren't real, media images and porn and things that, are
just not real,
idealized, altered, or considered attractive based on what they perceive men are looking at or wanting out of it. And men, unfortunately, not so much men, but younger men, boys becoming men, are getting skewed about what's normal as well.
Just by what you're seeing on social media.
By what they're seeing on social media, and also porn, because then it's so accessible right now that their brains are getting wired in an altered way than back in the day when you maybe had a Playboy, you looked at a magazine. It's not that, it's so much, so fast that it's changing the pathways of arousal in boys and girls, for that matter.
Do you see that changing anytime soon?
It's getting worse, and we'll see the impact. I think we are seeing the impact with this, everything that's going on with the Me Too movement is repercussions of that. These are the older guys that are now, they weren't in the midst of all this, and look what's happening to them. We'll see. And it's sort of on the upside of all that happening, these younger ones that are coming, are going to be, there's boundaries for them now before it gets out of control. Like a little bit of Harvey Weinstein, put those on steroids. That's what these guys would and could become. But we've sort of put a fence around them, hopefully that has it contained, and boundaries and awareness and sort of education and limits that it'll the pendulum will kind of swing back, hopefully.
Speaking for men who haven't done that, men know what's appropriate and what's not appropriate. Whether they follow what they know is a whole different issue, and clearly,
well, they may know, but they don't care, or they know but the rules don't apply to them.
Right.
And I saw that because my daughter was in boarding school for a year back in Connecticut, and I had this epiphany is when it starts, and it starts in probably like when they become sort of high school. Boys are starting to learn what they can do and what they can't do, what they can get away with, what they can't, what girls will allow, what they won't, where, you can move and where you can't, and where you stay in. And in these elite boarding schools in particular, in private schools too, especially for athletes, scholars and athletes, there is this gross sort of turning a blind eye to bad behavior, behavior that crosses the line a little bit. And, so just my daughter, just in the 1 year, that there was several instances that impact her and her friends. And I was shocked and appalled at how the administration sort of handled it. And
is this pre Me Too or post Me Too?
Beginning in the midst of it. I mean, this was a year and a half to 2 years ago. So we were in the throes of it, but not. I think Kevin Spacey was about to get Harvey. They were coming out. So this is going on out in the world, but in the confines of in the private institution, the rules and laws that apply to the outside world don't apply in there. And that's when they're learning, this is what I can get away with, this is what I can't, this is what these girls are allowing me to do, this is what they're not. And if they get away with it in high school, which most of them do, a thing here, a thing there, by the time they get into college, then it takes another step, then it pushes it a little bit more, and everybody keeps on turning, well, he's going to Yale, or he's there, or that. And then, so the girls are I felt like women are equally as responsible as the administration as of boys, because we're sort of turning a blind, we're not even turning a blind eye, or this is just what they do, or whatever. So, I think that there's a heightened level of awareness now. And yes, they know right from wrong, but they are enabled and
especially
allowed
the athletes,
and sort of protected.
Shifting gears again,
Mm-hmm.
Do you consider yourself to be an influencer?
I wouldn't necessarily consider myself a social media influencer, because I haven't used my social media to say, do this, do that, this is this, this is that. But I'm an influencer from the standpoint of my voice, and that when I have opinions and when I talk, publicly to, on camera or off camera, that people hear me, believe what I say. I've managed to maintain, my credibility. I haven't, gone off and become the poster child for Viagra. I've remained kind of impartial as an expert and an advocate and a activist.
Do you see both men and women?
I see predominantly women now, but men in the context of the relationship of women, like the partners or boyfriends or of my patients and other men that happen to come in, but I don't have a huge male practice.
What are some of the common misperceptions, and I'm going to ask it both ways, that women have about women's sexual health, their own sexual health?
The misconceptions, I'm not sure if it's misconceptions, but that women sometimes don't I think it's changing now, and it's partly generational, but there was a time where, everything, it was up to the man to, what he wants, or that it was very dependent on my satisfaction is based on him doing or not doing something, or him being or not being something. And the responsibility for your own sexual health and satisfaction, enjoyment, that was sort of something that women didn't really grab onto, and that's changing, especially with these millennials coming. They've got that covered. They're very empowered and entitled and fluid and all that stuff. So I think that from the male side, men feeling that pressure in terms of orgasm, which then leads to women faking orgasms. That if she's not doing this or doing that, then I'm not pleasing her, or that I'm not good, or that I'm not. I need to find somebody else who I can. That sort of thing. And it's usually just a matter of education and communication.
Shifting gears again, I want to talk about your research. I saw that you have contributed to, and I don't know if this was the marketing term, but a weed tampon.
That was with a company called Foria, which was the cannabis oil that is to enhance it's CBD and THC, and it wasn't a tampon that they then developed a suppository with CBD THC based for menstrual cramps.
How did it work? I mean,
it just really well? It relaxes smooth muscle, so it helps with cramps, increases blood flow.
What else is on your plate? What's going forward for you in the future?
Well, I just got this in the mail when we're talking about men. Not to be intimidating or anything, we were talking about that.
Which is asexual. You're holding
This is a male masturbator.
And do companies send you these things?
They send me these things. And I haven't been in the male erotic toy space ever. I haven't been in the erotic toy space, period. But this is the Fleshlight, and it's so this is the future of, the virtual sex, and within this is like some Pentagon, NASA level silicone flesh-like material that is like human skin. And then in the Fleshlight, you put your penis in there. So on the future is that I want to be developing products, not necessarily this one, but working to develop products. I have a TV show that I'm working on with one of the executive producers from Bravo, two shows actually. So hopefully those will come to fruition. And yeah. And
tell us the names of your books again.
The books that I have is For Women Only, A Revolutionary Guide to Overcoming Sexual Dysfunction, Reclaiming Your Sex Life, a long title. And the other one is Secrets of the Sexually Satisfied.
And they're both available on Amazon?
Yes, both available on Amazon.
And how can people find you on the internet?
People can find me by Googling, Dr. Jennifer Berman. My website is bermansexualhealth.com. And this is the website in progress. I've hired my new SEO guy, who's your friend Isaac, to help me optimize the website and get it more user-friendly. So I'm in the process of doing that. And my social media is at Jen Berman, MD.
Thank you. It's been a pleasure.
Likewise. Thank you for having me.
That's it for this time. If you enjoyed our podcast, please write a review on iTunes and tell your friends to subscribe. If you have any questions about influencers or suggestions for future episodes, email them to John at Pfeiffer@pfeifferlaw.com. Thank you for listening.